what we did is we used data from the Center of International Bone Marrow Transplant Research, or CIBMTR, to specifically analyze patients who had diffuse large B-cell lymphoma, and then prior to transplant, they were in a partial remission by PET-CT. So we limited the patients to that population. And so we took these patients and then we analyzed the data in terms of how did they do with autologous stem cell transplantation. The reason we did this is that we found data that from 2017 to 2018, there was a 45% decrease in the number of autologous transplants being done for relapsed diffuse large B-cell lymphoma. This was suggestive to us that there were some people who had chemosensitive disease, but perhaps were not in a complete remission prior to the autologous stem cell transplant. And some of those patients may have been taken down the CAR T-cell therapy route instead of the autologous stem cell transplant route. And so what we found in our trial is that we stratified patients into an early relapsing group, so people who relapsed within 12 months, and a late relapsing group, people who relapsed greater than 12 months. And ultimately, we found that the progression-free survival at 5 years was 41% for both groups, irrespective of the timing of relapse. This number actually is fairly comparable to the outcomes of CAR T-cell therapy in large clinical trials, albeit CAR T-cell therapy in clinical trials was given to patients with chemo-refractory disease. So based on the data that we have from the CIBMTR and the historical data for autologous transplant and its role for chemo-sensitive patients, so people who are responding to chemo going into transplant, it is our feeling that this data sort of justifies and proves that autologous stem cell transplant should remain the standard of care for relapsed diffuse large B-cell lymphoma, even if you have only a partial response with PET-positive disease going into the transplant. This may change in the future because there are clinical trials that are going to be comparing CAR T-cell therapy directly to autologous stem cell transplant. But until we have concrete data, we found that the results of this trial show that autologous transplant is an appropriate and reasonable therapy to use in this patient population.